Hello, my name is Heaven Smith, and today I am going to inform you on some facts about eating disorders. Having an eating disorder is not a lifestyle choice. It's actually a mental illness, and it's a very serious mental illness. But it mostly goes unnoticed. I was researching the other day and ran into a website called the Center for Eating Disorders at Sheppard Pratt. And it informed me of many different eating disorders, including anorexia nervosa, bulimia nervosa, binge eating disorder, or BED, and many more that just weren't quite specified. The help of a website called Nita Feeding Hope, it tells us that anorexia nervosa is a serious, potentially life-threatening disorder. It's characterized by self-starving and excessive weight loss. Anorexia nervosa had the highest rate of any psychiatric illness, even major depression. It was over major depression. The mortality rate associated with anorexia nervosa is 12 times higher than the death rate of all other causes of death in females ages 15 to 24 years old. Without treatment, 20% of people with serious eating disorders, they die. The Center of Eating Disorders at William Pratt also informs us that eating disorders affect more than 10 million people in the United States. Also, eating disorders affect 4 times as many people with breast cancer. Most people are not knowledgeable about eating disorders, about their causes, about the consequences, or the warning signs that might indicate that someone needs help. The Eating Disorder Hope is an informational website that tells us that bulimia nervosa, it's psychological and it's psychological and it's severely life-threatening as well. But it's an eating disorder characterized by the ingestion of an abnormally large amount of food in short periods of time, followed by the attempt to avoid weight gain. They go and they do their purging of everything that they consumed. Bulimia nervosa affects nearly 2% of adolescent Americans. Bulimia mostly occurs in teenage girls and young women, but bulimia can cause severe medical problems such as electrolyte and chemical imbalances. It can cause intestinal problems, and it can cause serious damage to the esophagus. Eating Disorder Hope also tells us that the binge eating disorder, which is also known as BED, it's commonly known as a compulsive overeating or consuming abnormal amounts of food, but they feel like they're unable to stop and they are at a total loss of control. Binge eating affects more than anorexia and bulimia combined. About 3.5% of American women and 2% of American men suffer from the binge eating disorder. The most important part of this entire message today is that there's help to getting out of that misery. If you're a person and you're listening today and you have an eating disorder, please go ask for help before it's too late. And for guidance, there's many different types of treatments for eating disorders, such as the most common are outpatient treatment, which is seeing a therapist or a counselor. Number 2 is intensive outpatient treatment. Number 3 is the residential treatment. And number 4 is the inpatient and hospital treatment. They all sound a little intimidating, but any of these listed treatments are worth going through. But that illness is not worth losing your life for.